Hello, everyone, and welcome to today's Gentle Movement at Home session, Friday, May 8th. Can't believe we're already in May. Let's get started. Today, I'm Jen Hansen, as many of you know. I work at PNBC, and we're really lucky to be joined today by Ceri Jakobsen, who's a physiotherapist, for her first session with us. So welcome, Ceri. It's really nice to have you here.
Thanks.
Yeah. So I'll just go through a couple notes. Most of you are used to me saying all of these things, so thanks for bearing with me. The first thing is that, these sessions are not a replacement for an appointment with your health provider if you have specific medical concerns. And we just ask that you hold any questions you have about specific medical advice for your healthcare provider. We're not able to answer those questions. We are recording this video and it will be available after the session on our YouTube channel and in our Facebook page in the videos section. We also have a poll at the end of this that we really appreciate you completing so we can see if everyone's still enjoying these sessions. If you do need any help, you can email us at education@pnbc.ca or put your question in the chat. We probably will have a little bit of time at the end where if you do have a question about today's movement sessions for Ceri, you can put it in the Q&A and we'll just spend a few minutes chatting at the end if anyone has any comments or questions. I always like to do that. It's always fun to have a bit of a chat after. Next week, we've got 3 sessions coming up, Monday, Wednesday, and Thursday, 2 with Neil and 1 with Colleen Jorgensen. So that is very exciting, a new person there. And I think we will get started. So I'm going to stop talking. And Ceri, over to you.
All right. Thanks, Jen. Hi, everyone. Thanks for tuning in today. So like Jen said, my background, I'm a physiotherapist and I'm also a Pilates instructor. So half my work week is teaching Pilates, half of it is physiotherapy. I teach a wide range of Pilates classes. I teach a lot to our physio clients as well as then to people wanting a bit more of a workout style. So we're going to use some of those Pilates principles today. The main one we're going to look at is breath work. Mobility through our joints, and using imagery as a way of facilitating movement. So in kind of partway through my career, I worked at the pain clinic at Nanaimo Hospital for 5 years. The big thing I found working there was often with pain, the patients I would come across in the pain clinic, their past experiences with trying to introduce exercise or movement in their life is they'd always have a negative experience with it. So it was always too much. It would cause a flare up in many different ways. It could be muscle tension that flared up. It creates also then a stress response in our body. Everything our pain then gets heightened, right? So what we really would get back to working on is how do we create a positive experience with movement? So we thought, well, let's not call it exercise because often that can be a frightening thought to go and exercise when you've got a lot of pain. So we're going to think about just doing some movement today and how do we create a positive experience with it. So a good guideline is if you can think of doing half of what you know your max is. So if we're, for example, doing an arm raise out in front, if you know when you get to shoulder height, that's your max, you're going to go half that far. Okay, so you're staying well within a range that's comfortable for you to do. Or you know that, say, bending through your knees as you get deeper, that's your painful point, just go half that far, okay? And that's a good chance then of making it a good positive experience after. You don't get a flare up in your pain. And also then just looking at what a positive experience means for you. Is it that it makes your body feel better after doing the movement? That's a big one, that we always hope for. It makes you feel better just that you've accomplished something in your day. You've accomplished doing some movement that you know is meant to help your body feel better. It could be that you then get better sleep at night because you've done a bit of movement and exercise in the day. Anything like that, I need you to start to think about what does positive look like for you. Is it one of those things or is it something else that's what you want to feel as your positive experience with the movement? Okay. So again,
Ceri,
yeah.
Sorry to interrupt. Normally I don't interrupt, but we have the question, and I think that from one of the participants that I think we should answer, because
Sure.
it'll probably make them more comfortable doing this series if we can answer it now.
Sure.
So the question is Pilates possible for someone with 2 knee replacements?
For sure, yeah. So it depends on the type of Pilates. So we're not doing full-on Pilates today. Like I said, we're just using 2 of the principles, mobility and breath work and imagery. So some of my classes I teach for Pilates, people have hip replacements, knee replacements. So it certainly is possible, but it's just breaking it down. So often people will see Pilates advertised on TV or in a book, and it's mat Pilates, a traditional mat Pilates, which is a lot of abdominal work or a lot of deep movements, a lot of deep knee bends. And Pilates doesn't have to be that. So we can break it down into its fundamental principles, some of which are breathing, mobility, imagery, which we'll use today. And then it's very doable by a lot of people. So if I think of some of my clients that come to classes, you know, some of them are mid-70s, some of them are mid-80s, knee replacements, hip replacements, chronic low back pain. So it's very modifiable for all populations. Yeah, good question. All right.
Thank you.
Yeah, we'll get started with our movement. So you can do this sequence we're going to go through either standing or sitting on a chair. It's doable in both. Or you can intermix. If you feel you need a break from standing, by all means have a seat, or vice versa. So we're going to start with a check-in through our body. So arms are just relaxed at your sides, whether you're sitting or standing. First off, we're going to check in with our breath. Okay, so as you inhale, just see where it creates movement in your body. Okay, so as you breathe in, feel where movement happens. Does it happen in your shoulders? Does it happen in your chest, your rib cage? Where do you feel movement happening? So just take a couple of breaths in and out. Doesn't have to be a huge breath, but just feel where your movement happens in your body as you breathe in. And see if you can just make it a nice slow breath. Okay, so think of slowing your breath down a little bit. And think of all those different places where movement might be happening. So it might be your shoulders, might be the chest, and might be your rib cage. Okay, so see if you can find that slower breath. And we're going to start to move our attention up to our head. Okay, so where do you feel your eye gaze is at? Do you feel your eye gaze is level, straight ahead, or do you tend to look down? What sort of angle is your eye gaze at? And again, not to judge anything right now, but just checking in with your body as to where your eye gaze sits. If you wear glasses, you might notice, are your glasses on a bit of an angle? Okay, I know I tend to sit with my head a bit tipped right. Yeah, so and I notice that with my glasses. So I'm gonna level off my head. Okay. And then we're gonna check in with our shoulders. So how do your shoulders hang in relation to your neck? Does one shoulder sit closer to your neck or closer to your ear level than the other? And again, not judging it, just aware of where you're at to start today. Okay. We're going to move down into our arms. And how does each arm hang at your side? Does one hang further away from you? Does one hang with your thumb next to your thigh versus your pinky finger or your palm? How do they hang in relation to your torso? And again, not trying to change it, just noticing how each arm hangs relative to the other. Okay, we're going to check in with our lumbar spine, our pelvis. What sort of curvature do you feel you have right now in your low back? Is it an accentuated lumbar curve? You might use your hands to feel where it's at right now. Is it a flattened lumbar curve? Okay, do you hold tension there at all right now? And then moving to our pelvis. Our pelvis is like a bowl. So if you think of the pelvis like a bowl, is your bowl tipped at all? So is it tipped forward at all? Like we're going to lose the contents of the bowl? Is it tipped to one side at all? Just see where yours is at today. And moving into our thighs, okay, what do you feel the contour of your thigh is like? Okay, do you have more muscle bulk in one thigh versus the other? Or does one thigh turn in looking at the other one next to it? Okay, do you hold tension more so in one thigh than the other? Do you rely on that one leg to hold you upright versus the other? Okay, or if you're sitting down right now, do you feel your one thigh is rolled in or rolled out compared to the other? And that just gives us awareness of what's happening in that side. And then lastly, moving down towards our feet, just notice where your weight is distributed through each foot. Okay, do you tend to stand more so leaning towards your toes? Do you lean towards your heels? Or are you right in between the two? Okay, which is a nice place to be. Okay, and do you feel weights more on the left, more on the right? Do you feel it's even left to right side? Okay, so those are just all places we're going to check in with. We've checked in with them to start. And throughout the class, you can recheck in with those, or at the end, we can recheck those areas and see if it's changed at all. And again, we're not trying to judge the areas or change them right away, but just giving ourselves feedback, our nervous system some feedback as to where our body is at today. Okay. So we're going to get started with our mobility piece. Okay, so we're going to focus to start with on moving all the joints in our body, starting from head, working down to our toes. Okay, we'll do a little check-in with our breath again first and our postural position, and then we'll start to move. So coming back to that breath that we checked initially, okay, so now we're going to think of at your breathing point, our diaphragm, it sits like a dome. Okay, so if you picture it like an umbrella, okay, so a nice big umbrella and the stick is down below. Okay, so our umbrella diaphragm is at the bottom of our rib cage. And as we breathe in, see if ideally our diaphragm should move down, so that umbrella is going to flatten out a little bit. Okay, as though there's wind pushing at the top of that umbrella, flattening it out a little bit. Okay, as we breathe out, that dome comes back. Okay, so as we breathe in, that dome of the umbrella, the dome of the diaphragm flattens out a little bit. Okay, it descends. As we breathe out, it rises. Okay, so we're using our bit of imagery that I mentioned initially. Okay, so we're going to try and use imagery at each area in our body. So it did take a minute just to think of that umbrella as we breathe in, it flattens. As we breathe out, it comes back to that umbrella shape. Okay, and once you get that going, if you picture that umbrella, the edges of the bottom of the umbrella attach around the whole bottom end of our rib cage. Okay. And see if you can think of that breath in, as our breath comes in, can you send it to that whole circumference of the umbrella, okay, or the whole circumference of our diaphragm, so that you get movement in all aspects of the lower lobes of our lung. So often with pain, we tend to shoulder breathe or chest breathe. See if you can get our air going a little bit lower so that you create that flattening of the dome of our diaphragm, okay, or the dome of the umbrella flattens out a little bit, and then it rises with our exhale. Okay, and just see if you can use that imagery to send that air a little bit lower into the lower lobes of our lungs. Doesn't have to be a huge deep breath. Sometimes that can create issues, but more so just directing it to an area that we want it to go. Okay, so that dome flattens, and then it reverts to the dome. Okay, so I'm going to get you to see if you can keep that breathing going throughout our movement. Okay, so you can keep checking back with your breath pattern, see how it is, if you kept that lower breathing versus any chest or shoulder breathing. Okay, so keep that going. We're going to start our movement up in our head and neck area. So for our imagery piece, we're going to be doing a little bit of side bending through our neck. But I need to imagine as though your head was a teapot, okay? And out one ear is the spout of your teapot, okay? Or, here we go. So you're gonna think of just gently tipping tea out of that ear or out of that spout, and then center your head, okay? And then your other ear has the spout, and you're gonna gently tip T out of that ear or out of the spout and back to center. So you're going to alternate sides and imagine, I think of my British grandmother, just testing the tea she's brewed. So just pour a little drop of tea into a cup, see if it's ready, and then back to center. Okay. Just tipping each way, keeping that breath pattern going. Okay, so you're getting that breath going into that lower aspects of the lobes of your lungs. Okay, and just letting that movement happen. Okay, so if you're tipping to your left, you've got the handle here on your right, just gently tipping up to let the tea tip out of your left ear, back to center. If you're tipping right, you've got your handle on your left, lifting up, so you tip the tea out of your right ear. So it's just creating some side flexion in your neck. So often, if someone can be asked, if they've got neck issues, well, you should do some range of motion through our neck. But what tends to happen is we just kind of crunch our head side to side. If we can do it a bit more thoughtfully like this, we can create a bit of movement in the upper segments of our neck, which can really help creating a bit more movement rather than just crunching in an area that often takes the brunt of the work. Okay, and again, think of that guideline as to, if you know what your limit is, your maximum with your side bending in your neck, think of doing half that much. So we're not trying to reach a point of pain with it, trying to stay in our comfortable range of motion. Good. So then back to the center. We're going to stay at our neck for a moment, but a different movement. We're going to do some rotation, okay, which would typically be looking over your shoulder. But as our imagery piece, if you think of the vertebra in your neck, okay, so the vertebrae are all stacked one on top of another with a little bit of a curvature in it. So if you imagine those vertebrae are like a pack of lifesavers, okay, so most of us can visualize those colorful lifesavers in a pack. And you're going to start the rotation in your neck by swiveling that very uppermost lifesaver on that stack of lifesavers. You're going to swivel it a little bit. Okay, so you're going to swivel that uppermost lifesaver to your left, and then the lifesaver below it's going to start to swivel left, and then the one below it, working your way down. And again, just moving in your comfortable range. And then you're going to reverse that to come back to face forward. So starting at the lifesavers at the bottom, start to unwind those ones, working your way up to that uppermost lifesaver. Okay, and then you're going to start to go the other way. So starting at that uppermost lifesaver, you're going to swivel it to your right. Okay, looking a little bit right. And then the lifesaver below it starts to swivel right. The one below it. And again, staying in that comfortable range. Making sure you keep that breathing going. So still aware of that umbrella as the diaphragm at the base of your rib cage. Just taking it nice and slow. So slower movement always, again, is a way of having that positive experience with movement. If we go quick, it tends to create more of a guarded response in our body. So see if you can go nice and slow. Good, we'll do one last one. Good, and again, all of these movements can be done sitting, so feel free to sit or stand wherever you're most comfortable. Good. So we've done some side flexion in our neck, some rotation in our neck. We're going to move now down into our shoulders. Okay, so your shoulder blades, we're going to move at your shoulder blades to start. They sit like two triangles on the back of our rib cage. Okay, so at the upper aspect of our rib cage. And we're going to move those shoulder blades. So if you imagine those shoulder blades, it's two bars of soap on the back of your ribs. Okay, and they're going to give you just a nice gentle scrub on the back of your rib cage. Okay, so those shoulder blades, the bars of soap are going to scrub up a little bit and scrub down. Okay, a breath in to slide them up, a breath out to slide them down. Okay, again, taking it at your own pace. If you know you're tentative with movement, I would go much slower. Okay, so choose a nice slow pace for you. Okay, so a breath in to slide those bars of soap up the back of your ribs, a breath out to slide them down. And just see how you feel the left versus right shoulder blade move. Do they move at the same rate as you slide them up and down? Do they move with the same ease as you slide them up and down? Or is one a little bit sticky? Does one want to kind of jigger its way up, like it's scrubbing over something really rough. Okay, so if you can just smooth that out, so you're going to use your breath to smooth it out. That nice breath in. You're going to use your awareness to slide it out, to smooth it out. Good. So rest there for a moment. Now we're going to do more of a circular scrub with those bars of soap. Okay, again, just gentle. So you're going to slide those bars of soap up, slide them back, down, and release. So slide them forward, up, back, and down. Okay. And again, think of doing that half the amount of what you know your maximum is. So especially if you've got neck or shoulder issues, you might just do a smaller circle. Think as though you're drawing a circle on the back with those bars of soap. That's the size of maybe just a drinking glass. Okay? If you're comfortable with your shoulders, you might draw a circle with those bars of soap more the size of like a cereal bowl. Good, and again, just noting how it feels left versus right shoulder blade. Okay, do they move with the same ease? Do they move at the same rate? Good, last one like that. And then let the shoulder blades rest. We're gonna now move more in the actual shoulder joint. Okay, so we're gonna be moving your whole arm bone to create movement in the shoulder joint, okay? So initially in our body scan, we took note of how your arms were hanging at your sides, okay? Sometimes if we hold tension in one shoulder, that shoulder can wanna sit a bit turned in. So your thumb might rest at your thigh rather than the palm looking at your thigh. So we're gonna try and just loosen that up. So with your arm bone, if you imagine your arm bone is like a Barbie doll arm, okay, and you can really easily pivot that arm bone, okay? So we're gonna pivot both arm bones outwards. So as though you're showing the face of your elbow forwards. And then you're gonna pivot both arm bones inwards, so that face of your elbow looks behind. Okay, so pivoting it to face forward and then to face behind. And again, you can get a pattern going with your breathing. So once you get the movement piece going, okay, you've figured that out, you're spiraling that arm bone out. Think of pivoting that Barbie doll arm so the face of your elbow looks forward and then behind. You can think of a breath in to face the elbow forward, a breath out to turn the face of your elbow behind. Okay, again, just choosing that comfortable range. Good. Think of that breath in. Again, it's traveling right down to that whole circumference of that edge of the umbrella. There are the edges of your diaphragm. Good. And again, slower is always a little bit easier. Or if you know you hold tension in this area, think of slowing it down. Good. And then rest your arms there for a moment. Okay. We're going to now do a bit of movement through your thoracic spine. Okay, so our thoracic spine is from the base of our neck to the base of our rib cage, here to where it meets your lumbar spine. Before we do the movement there, we're going to just check into where our posture is at. So I'm going to give you an imagery for your posture. If you imagine the wall behind you, whether you're sitting or standing, imagine the wall behind you is magnetized. And you have a magnet at your throat, at the base of your sternum, okay, at the xiphoid process, and at your pubic bone. And imagine those three magnets just gently drawn to that magnetized wall behind you. So you're not going to lean backwards or move your body way back, but just imagine there's a little bit of an attraction of those three magnets to that magnetized wall behind you. Okay. And that just helps avoid, most of us nowadays tend to be forward if we're driving, if we're doing computer work. That can be our tendency when we're standing or sitting, is to perch forward. So it just creates a little bit of connection in the deep stability muscles in your neck, the deep stability muscles in your core. Just have that gentle attraction to the wall behind you. Okay, not a forceful movement. So now imagine, see if you can keep that sense. And if you come back to our idea of our diaphragm as like that domed umbrella at the base of our rib cage, and we're going to slide everything above it. We're going to slide our rib cage off one edge of the umbrella and off the other edge. Okay. So imagine that umbrella stays steady, so that diaphragm stays about where it is. You can just slide your rib cage off one edge of the umbrella and then off the other edge. Okay, so you might feel your hand glide down the side of your thigh a little bit and then over the other side. Okay, so think of you're really initiating the motion at the rib cage. It slides off one side of the diaphragm or off that umbrella and then the other. So sometimes what we might do is we might just do our head instead. Okay, if we're stiff in that area at our ribs, we might just do our head to feel like we're doing some movement, but we're not actually getting that movement in our rib and thoracic spine. Or we might just side bend in our low back, which is really typical, but that can irritate a already irritable low back. So we're going to see if we can create movement in our rib cage, which is typically a stiffer area from the sitting that we do. So sliding that rib cage off one side and then the other. And again, you can get a pattern going with your breathing. Think of a breath in to slide to the side, a breath out to come to center, then a breath in to slide the other side. Again, just staying in your comfortable range. To go to where you might feel a bit of a stretch is okay, but make sure it's a comfortable stretch. Good, then you're gonna pause in the center. So then we're gonna integrate those couple areas we just did all together. So we're gonna do a bit of movement at the shoulders, the shoulder blades, and our rib cage. So you need to start by taking the backs of your wrists towards each other in front of you. Your fingers point away from each other. And then you're gonna pivot your palms to face forward, fingers again point out away from each other, and open your arms. Okay, so you get a bit of opening across your chest and into the tissues in your arm. And then again, you're gonna bring the back of your wrists to meet. Okay. And then pivot palms forward, open your arms. Okay, so now if you're comfortable with that, you can add a bit of movement through your thoracic spine. If this feels enough for you, just stay with this. Okay, so if you're gonna add, as you open your arms, you can imagine a kite string at your sternum attached to a kite up in the sky. And that kite's just giving your sternum a little tug upwards, okay? And then release that as the back of your wrists come together. You think of that kite string that's down on the floor, your kite fell to the ground and it's just gently tugging your sternum forward. Okay, and then again, palms face forward, fingers out. That kite string gently tugs your sternum up as your arms open. And then backs of your wrists come towards each other, your kites hit the ground, tugging your sternum a little bit forward. Good. You can add one more piece if you like, a breath in as you open your arms, a breath out as your arms come together. Good. And again, nice and slow, just taking out that comfortable pace for you. Good. One last one. And rest your arms. So we're going to keep moving down our body. So now we're going to move our attention to our pelvis and our hip joints. So to start with, if you have your hands on your hips, so I'm going to show this first option in standing, and then I'm going to show an option in sitting if you're sitting. So for the standing option, hands on your hips, and you're going to think of just gently shifting your pelvis forward in space. Imagine your pelvis was resting on a cloud, and that cloud is drifting forward through the sky. So if you're unsteady with your balance, you might have your hand on your chair or on a countertop close by. You're just going to let the pelvis shift forward slightly on that cloud and then shift back slightly. Okay, it can be a centimeter of movement. It doesn't have to be big. Okay, so that's the standing option. If you're doing the sitting option, okay, you're going to more so do a hinge of your pelvis. You're going to tip your pelvis forward as though you're going to start to stand up. Okay. And then you're going to tip the pelvis back as though you're going to lay back. Okay, but again, a centimeter of shift forward, maybe a centimeter back. Okay, but try to feel the motion is at your pelvis, hinging forward, and then a little hinge back. Okay. and then rest there for a moment. We're gonna then do, again, staying at our pelvis and hips, but we're gonna do a lateral translation. So now that cloud that your pelvis is sitting on, so this is again the standing option, that cloud is drifting left. Okay, so again, aware of your balance, use a chair or counter if you need to. That cloud, your pelvis is shifting a little bit left and then a little bit right. Okay, just be aware of how your balance is as you transfer your weight a little bit more onto one foot and then the other. Okay, so that's the standing option. If you're sitting, same idea, we're gonna do a bit of a tip through your pelvis. So you can imagine your torso as though it's a tree, okay? And that tree is swaying in the wind, a little bit left and right, okay? So again, just nice and slow, let that tree sway a little bit left, so your pelvis ends up tipping a little bit left, and then a little bit right. Okay, both buttocks are still on the chair, but you might just feel a little bit more weight come into one, and then the other. Again, stay in your comfortable range. So it's not super windy, okay? It's not a huge blowing storm. It's just a little bit of wind out there today. Good. And then resting there. Good. So then we're gonna do, again, I'm gonna show the standing option first. This is our last movement. We're gonna do at our pelvis. You're gonna do a circular motion. So similar to what we were just doing. Okay, so imagine now that cloud was doing a circular motion, okay? Or if you had a pencil coming down out of your pubic bone, aiming to the floor, and on the floor, you're gonna draw a size circle. So it's a very long pencil. You're gonna draw a size circle, maybe the size of a coffee mug, okay? Or if you're really comfortable with your hips, it might be the size of a cereal bowl, okay? So hands on your hips, you're gonna start to shift your pelvis a little bit right. So your pencil's now at that one edge of the circle. And then you're gonna shift your pelvis a little bit forward towards that front edge of the circle, a little bit to the left, a little bit back, okay, and over to the right again. So again, staying in your comfortable range. It's not a hula hoop, okay, but you're moving your pelvis, your torso goes with you. Okay, so you shift a little bit right, forward, over to the left, and back. So you can aim to maybe do 4 or 5 circles in this one direction, and then you're gonna change direction. If you're sitting, similar idea, okay, with that, if you think back of that tree, okay, our torso is a tree that's gonna sway in the wind a little bit. Imagine a tornado now has caught that tree and you're gonna do a circular sway with it, okay? So you're gonna tip a little bit right, tip a little bit forward, over to the left, and a little bit back. Okay, again, find your comfortable amount. Okay, so it might be a very subtle, weak tornado. Okay, it's not a huge movement. Okay, it's just to give you a bit of an image as to what to think of. Good, and again, about 4 one way, and then you're gonna change direction. Good. Good, again, check in with your breathing, make sure you've still got that breath in, traveling right down to the bottom edges of that dome of your umbrella at the diaphragm. Good, so rest there. So now we're gonna move down, creating a bit of movement in your knees and ankles. So this one, again, I'm gonna show you first an option, standing and then seated. If you imagine now you're a puppet, okay, and you've got a puppet string from the top of your head to the ceiling, and that puppet string is gonna just slacken a little bit, okay? So you start to let your knees bend, your torso stays upright, okay? And then that puppet string tugs you back up, okay? So the puppet string slackens a little bit, and then it tugs you back up. So going back to what I said initially, if you know you've got knee issues, again, know what your maximum is with your knee bend and think of doing half that much. Okay, or same thing, if you've got ankle issues here, think do half of what you know your max is. Okay, so you're staying in a comfortable range. If you're seated, okay, so here we're gonna do more so a knee extension forward. So if you imagine a puppet string at your toes, and that puppet string is tugging your shin up in front of you and back down. Okay, and then the puppet string on your other foot's going to tug your leg out in front and back down. Okay, again, staying in that comfortable range. Both standing and seated, you could get a pattern going with your breathing. As you extend your knee, as you straighten your knee, a nice breath in. As you bend, a breath out. Okay, or vice versa. It's just mainly if you can get a rhythm going. As you do one phase of the movement, do a breath in. As you do the other phase, do a breath out. Okay, often people ask me, well, I get confused with the breathing, which is normal. Don't worry too much about if you've got it right or wrong. Just create a rhythm with it. Breathe in for one phase of the movement, breathe out for the other phase. Good, last one. And then lastly, down at our feet, okay, we're gonna do, I call it treading through your feet. And this you can do, if you're sitting, you're gonna do the same thing sitting as I'm gonna show standing. So your feet to start are, the soles of your feet, you want them in contact with the ground. So that's one thing, sitting, make sure the soles of your feet are in contact with the ground. Imagine the whole sole of your foot is like a sticker, okay? It's stuck to the ground. And you're gonna slowly peel, we'll start with your right foot. You're gonna slowly peel the sticker, the sticker up off the floor. So starting at the heel end, you're gonna slowly peel up the heel. Okay, then towards the base of your arch, and moving forward through the arch, through the ball of your foot, and just pausing where the soles of your toes are still on the ground, okay, but your heel is lifted. And then you're gonna land that sticker back down. Like, oh no, maybe I'll keep that sticker. You're gonna land it back down. Okay, so rolling down through the arch of your foot, and then lastly towards your heel, and then we're gonna do the other foot. Okay, so you just shift your weight a little bit to one side. Now start to peel up the base of your left heel. Think as though it's that sticker, you're peeling up the back tip of it, and then through the arch, the midsection of your arch. Okay, your heels just start to get a bit higher. You're gonna leave the soles of your toes down. Okay, and then slowly land that sticker or the foot back down. Okay. So we're thinking of movement, mobilizing the joints in your foot as well as your ankle, but it also creates movement up the chain. Okay, so we're kind of focusing in on certain areas, but it does create movement elsewhere. So it works a little bit on your balance, works on movement through the foot, ankle, knee, hip as well. Good, we'll do one last one. Good. So then we're going to, so as we kind of mobilize through the joints through your body. Now we're gonna put a few of those areas together, but doing just a bit more more functional movements. Okay, so we're gonna do, to start, a sit to stand motion. So if you've got your chair, you're gonna have a seat on your chair. Okay, so we've just loosened up through those areas. So you need to sit towards the front end of your chair so that the soles of your feet are on the ground and your heels are a little bit behind the line of your knees. Okay. So we did earlier, for those of you who are sitting, we did that hinge forward of your pelvis, okay, and then we hinged it back. When you go from sitting to standing, you want that same motion to start. So if you have your hands on your hips, think of tipping your pelvis forward. So we talked earlier about it being a bowl, your pelvis. You know, tip the contents of your bowl out so they tip down to the floor, okay? And that's our initiation to get up to standing, okay? So if you feel that's enough for you, you're gonna stay with that, just that tip forward of your pelvis and then back. So you're doing that preparatory movement for sit to stand. If you're comfortable with doing a sit to stand motion, you're gonna start with that hinge forward of your pelvis. Feel a bit more weight come into your feet. See if you can line up your nose over your toes, a little squeeze of your buttocks, and then pressing all the way up. Okay, and then we're gonna reverse that to sit down. Then start to fold your pelvis forward. You're tipping the contents of your bowl out towards your feet. Nose is over your toes to slowly land your hips back down. Okay, and then again, tipping the pelvis forward. So again, you can stay with just this hinge forward if you like, or if you're comfortable with this sit to stand, you're gonna hinge your pelvis forward, tip the contents of the bowl out towards your feet, nose over your toes, little squeeze of your bum to straighten up. Good. We'll do one last one. So again, we're going to tip the contents of your bowl out towards your toes. Bring your nose over your toes, squeeze your bum to then straighten up. Good. So then we're going to do a little awareness of where our hip joints are to then do more of a mini squat motion. Okay. So to find our hip joints, often if we think of where our hip joints are, someone says maybe these bones at our sides, or maybe it's up here. Our hip joints, the actual ball and socket joint, is really, really deep. We can't actually get our hands on it. So to find the area of it, if you take two fingers on one hand, place it at the crease at the front of your hip. So if we were to bend that crease, that happens. The other hand, the same side hand, you're going to take it at the base of your buttock, your sit bone. Okay. So then if you just keep those hands there, so both hands are on one side, so I'm on my right side of my pelvis. I'm just going to do a little bend, okay, and just feel between those two sets of fingertips, deep between those two sets of fingertips is where our hip joint lies. And that's ideally where movement should happen when we do a squat motion like this, or when we do a sit to stand motion like we just did, okay? So just have that visual of deep between those two sets of fingers is where your hip joint lies. It's a ball and socket joint, okay? And that's where we want movement when we do a motion like this. Okay, then we're gonna try the other side. So your two fingertips come to the front of the hip, that crease that happens if we bend. The same side hand, two sets of fingers to the base of your buttock. Keep them there, and again, you're gonna do that little bend and straighten out. And just again, have that visual, so we're using that imagery, visualization, between those two sets of fingertips. Deep between them is where our hip joint lies. Okay, so it's giving you a bit of feedback, often with issues around our hips or any area. If we've got an issue, say at our knee, we lose good proprioception, awareness of where that joint is in space. Or issues around our pelvis or hip, we lose good sensation of where that body part is in space. So doing, adding tactile feedback, so using our hands for feedback to our body or using a mirror for feedback helps us out. It helps improve it. So now relax your arms and see if you can keep that image now, thinking of both sides. Deep between those 2 points is where our hip joints lie. You've got two. And see if you can just feel a bit of movement happen there. You don't have to go low, just doing a little bend. Okay, and again, same thing sitting, or not same thing, but sitting, you can have that same image. You're gonna just do that little rock as though you're doing a bending action like I was just showing standing, and just keeping your focus to where those ball and socket joints lie. Okay, so if you feel that's where your movement happens, rather than rounding in our back to move forward or just moving our head and neck forward, can you get the motion happening deep in those hip joints? So they're nice big joints, those ball and socket joints. They're meant to do that motion for us. And often we end up doing the motion, if we're stiff in our hips, our low back can take the brunt of the work instead, which is not what we want. Okay, so we end up maybe doing something like this to bend forward rather than really hinging in our hip joints. Okay. So you can think of that if you do any little squats as an exercise at home, or if you're bending down to lift a pan out of the cupboard, think of that action coming in your hip joints. Okay. So rest there then. We're gonna just move up to a couple last movements in our upper body, again with a bit more functional sort of movements. You're gonna have your arms out to your sides. Now any shoulder issues, you might have your arms low around belly button height. If you're comfortable with your shoulders, you could have them more around chest level. And you're gonna think of giving someone a big hug, okay? So we've been lacking in hugs, I think, lately with the pandemic situation. So arms just softly out to your sides. You think of wrapping your arms around that person in front of you, giving them a hug, and then open back out. Okay, and again, we're gonna integrate our breathing into it. You're gonna take a breath in to open your arms, and a breath out to give them that hug in front. Okay, so inhaling to open your arms, exhale to hug in front. Okay, so you're incorporating now movement in your shoulder joint, movement in your shoulder blades that we had those bars of soap moving. You're using your breathing, so as you breathe in, you're getting your air right down into the lower lobes of your lungs. One last one. And then rest your arms there. And then we're gonna do, again, integrating shoulders, shoulder blades, and our breathing. We're gonna do a row type action, okay? So palms face the ceiling, elbows are bent, okay? Check in with your posture. Think of that magnetized wall again behind you. Magnet at your throat, the base of your sternum, and at your pubic bone. And there's just that gentle attraction of those three magnets to the wall behind you, okay? So we're doing a row, but for our imagery piece, imagine you've got a tray of cookies on your hands, okay? And we're now allowed to offer up, share things with others, okay? The pandemic hopefully is slowly settling. So I have a few steps ahead here, but soon we'll get to that stage, sharing cookies. So on our tray, we've got some nice cookies or your favorite treat, and you're gonna offer that tray forward to your friends you haven't seen for ages, and then bend your elbows back in, okay? So an inhale to send your arms forward, exhale to come back in. Okay, it's a nice light tray. Okay, so think of just a soft glide forward and back in. Okay, and just see if you can feel those bars of soap on your back. They're moving with you here. So your shoulder blades, they glide along the sides of your ribs as your arms extend forward, and then they glide back in towards your spine as your elbows bend. Okay, so you've got that breath in, extending forward, a breath out, coming back in. Good, one last one. And then rest your arms there. So we're gonna finish up with just checking back into our breathing and having that little scan again through our body. Okay, so arms just resting at your sides again. You can be sitting or standing. Come back to awareness of our breath. Think of that whole circumference of your rib cage is where that, just a kind of basic visual of where the attachment of your diaphragm is. And it's like an umbrella, your diaphragm. As you breathe in, see if you can get that air going right to that whole edge of your diaphragm, the whole circumference of your umbrella. Let that umbrella flattens a little bit. As you breathe out, it rises. Okay. So just see if maybe that feels a little bit easier for you to do now. Okay. And a good judge when you're doing movement as to how much is good, how much is too much. So I had that 50% idea. So know what your max is. Think of doing half that amount. For your breathing, an awareness piece you can use is if you are doing a movement and you find it takes your breath away because it hurts. So if it makes you wince or makes you catch your breath, first off, you want to check back with your breathing, see if you can control it. If you feel you can't, then that movement might be too much for you. Okay, so think of scaling it back a little bit to where you can keep this good breath pattern. Okay, so ideally movement should always be where you can keep a good breath pattern going. Okay, if we don't, if our breath pattern, if we're losing it, then we know we're starting to hold tension elsewhere. Okay, so you're gonna keep that breath pattern going. We're just gonna do a quicker scan through our body to finish up. Okay, so coming back to how our shoulders hang in relation to our ears. Can you feel there's a little bit of softness in those muscles between our shoulders and our ears? Okay, so think of them as just nice, supple, soft sponges, and they're just nice and soft at the sides of our neck, okay, just helping gently support our arms. We're gonna think of our head, how it's positioned. Oh, my eyeglass feels like it's more level. Maybe I've loosened up, okay? So see if you can feel your eye gaze is straight ahead, it's level, okay? Sometimes it's easier to feel if you've got glasses. I can see the rim of my glasses. Okay, checking in there, checking into how your arms hang. So how do your arms hang at your sides? Are they similar side to side, or is it both palms that face your thighs? Is it your thumbs that face your thighs? Okay, are they relaxed at your sides so they just feel nice and loose? And then checking in through your lumbar curve. Okay, how does it rest? Is it in just its natural rest curve? Or are you holding tension there? Is it flattened out? Okay, or is it overextended forward? So see if you can just think of those magnetized points, pubic bone, base of your sternum and your throat, just draw into that magnetized wall behind you. Help give a bit of support to your lumbar spine from your deeper abdominals. It's not a suck in, it's just a gentle attraction with those magnets. And then checking in with your thighs. So how are they resting in relation to each other? So if you're sitting, is one fallen out or inwards? If you're standing, same idea, is one pivoted in more than the other? Okay. If it is, you can think of using some of those pelvis movements we did standing to help free up. We're moving our pelvis, but we're creating a bit of movement in the hip joints as we do that. And then checking in with our feet. Okay, so how is that weight distributed again through each foot? And same thing sitting. Okay, is it more towards our toes or heels? Is it similar left and right foot? Mine feels a little bit more similar now, left and right, after doing those movements we did. Good. So I always encourage people to use a bit of breathing, bit of relaxation to start their exercises, okay, or a body scan. Use it throughout as well. Use your breathing throughout to check back in with it. Can you maintain that good breath pattern while you're doing your movements? You end up having more of a positive experience. If you're not able to breathe well throughout, we know then we're probably starting to hold muscle tension in places, which then is usually going to cause a bit of a flare up afterwards. So try and always check back in with your breathing, and then taking some time at the end. It could just be short like we just did, a little bit of breathing, or it could be a good 10-minute relaxation period using a bit of breathing exercise, using a meditation that you do to help relax your body after. So again, we're more likely to have that positive experience. So now after doing these movements, I get you to try and think of what's one positive thing that you can feel from today. Is it that your joints feel a little bit more limber? Do your muscles feel a little bit softer? They've loosened up? Or is it that you feel in a better mood now? You've done some movement, or you feel a little bit awakened after moving around a little bit? Is it now that you know a few things you can do simply at home that you can watch again later on the YouTube channel to help get into a bit of a rhythm with doing some exercises? So I challenge you to try and find that one little positive thing, and it might be, you know, one thing's positive, one thing's negative. Maybe, you know, maybe you do feel a bit sore in one area, but you've got that positive aspect of, well, I know how to adjust it. I can try and play with that 50% rule. I can continue to check back in with my breathing a bit more often, so that next time I do it, I don't get that soreness afterwards. Okay? Or maybe it's just a little bit of soreness that I can use a heat pack over to help settle that. So thanks for joining us today, and thanks PNBC for organizing these. It's a great idea. So I'll hand it back to you, Jen.